Imagine you get a phone call from an older family member to meet them at the emergency room. You rush to find that she's been hospitalized for an asthma attack. In the hospital, she was prescribed steroids for asthma, which then made her blood pressure rise and caused vertigo. At the hospital, she was given blood pressure medication, and that made her dizzy. While she was there, her ankles began to swell, and so she was given a water pill, which caused her potassium to bottom out, and then she was given potassium supplements, and then to top it off, she was given something for osteoporosis. And that made her, and then after that, with the potassium supplements, that caused gastroenteritis. And then she was quoted as saying as she was leaving, "I came out sicker than I went in." This actually happened to an 83-year-old grandmother, according to the Journal of Health Economics. I'm here today to persuade you with information on how the elderly in our society today are being over-medicated by doctors, pharmacists, and how we can help protect our loved ones. First off, let's see how doctors, the first source of over-medication from our seniors, are doing this. According to Siri Carpenter of Prevention Magazine, although medications can ease many of the conditions, multiple drug use often exacerbates existing ailments and causes troubling side effects that are treated with yet more drugs. According to the Journal of Health Economics, which is part of the health policy to improve efficiency, contributes to more prescriptions for the elderly. From 2007 to 2009, there are an estimated 99,628 emergency room hospitalizations annually for adverse drug reactions in individuals 65 years of age and over. The Institute of Medicine estimates the cost of medication-related problems among the elderly in the billions of dollars. Stated an NBC report news study highlights dangers of medicated seniors. Senior living states that although seniors currently they only comprise 12.4% of the population of the United States, they consume nearly a third of all prescriptions and over half of all the over-the-counter medications in the country. 90% of seniors over 65 take some sort of medication daily, and 50% take at least 5 drugs every day. And 1 in 5 prescriptions written for elderly patients was found to be totally inappropriate. A great majority of seniors are written prescriptions that cause a reaction, and then they are given prescription for that reaction, and then another one for that reaction, and it continues in that manner. They just keep getting more prescriptions. And there's, I'll give you an example. There's a drug for high blood pressure called Toprol, which is a beta blocker, and that causes serotonin to be blocked in your brain, and that will cause depression. Now you go to the doctor, well, because I'm feeling depressed, and now you're on antidepressants. So that happens to a lot of seniors, and you can see how they're going on multiple medications instead of getting to the underlying cause in the first place. And like I said, this is called the cascade effect, and this was according to Kathleen Woodruff in an article written for American Nurse Today. Now let's take a look and see how pharmacists contribute to our over-medication problem. Reviewing medications with the family would be reducing or simplifying medications. So a lot of times the pharmacists are not looking to see how many drugstores or pharmacies that the patient is actually going to. They're not looking for drug interactions, which basically is their job, but they're not doing that. They're not seeing how many doctors these prescriptions are being written for patients, and they're just basically just getting them in and getting them out. And that's so now what we can look at and see how we can protect our loved ones, and when it comes to being over medicated. And so we can do, well, we have to have their backs. When we should actually have to go with them in order to, so they won't get over medicated. we should go with them and actually either make a list or do what a lot of, what senior living suggests is the brown bag review. Take everything they've got, even supplements, take all their medications, over the counter, senior living suggests over the counter drugs, their regular drugs, and they encourage patients to make a list, to write, bring everything, and everything that you would like to make a whole list of, and if the doctor starts saying, oh, this is taking too much time or anything like that, and not giving you any suggestions or reviewing what the patient is taking, that's when you go elsewhere. Because we're all going the same way, and I don't think any of us want to, be over-medicated in our golden years. And you can also ask the doctors if there would be a chance that diet or exercise would be something instead of taking a bunch of medications. So, now that we've taken a look at how the elderly are being over-medicated by doctors, pharmacists, and how we can protect them, perhaps next time you're visiting an older neighbor or family member and they appear to be acting strangely or disoriented, instead of taking it as a sign that they're just getting a little older or whatever, blowing it off, maybe you can take the extra step and ask them if they've been to a doctor or a pharmacist that had a change in medication or dosage, and he can step in and perhaps change their quality of life.
Very good.
Yeah.